I'm Oskar Thorvaldsson, CEO of Dr. Clark's store, and I wanted to do some interviews with awesome people, experts in cancer here at the Annie Appleseed Conference. So I'm looking forward to get some people to talk to. Thank you. I'm here with Katherine White, and this is our second interview with her. We are at the Annie Appleseed Conference here in West Palm Beach, Florida. The last time I interviewed Katherine White was back in 2008. Many years ago. That was such a serendipitous interview because we were already making a documentary. She just fell right into it, and now another very beautiful things are happening. Her daughter is Petra Sovkov, and she's has a PhD in herbology, and she is a clinical herbalist and therapist and doing lots of good work with the 21-day program of Dr. Hulda Clark. But anyway, I want to welcome you here again, and wanted to ask you how you found out about Hulda Clark.
Interesting story. The book came to me through a card of somebody that they say they were my good friend. Okay. About 2 months prior to my diagnosis of my ovarian and cancer.
So 2 months before
Correct.
You were diagnosed, you got a card in your mailbox?
Correct. I got a card in my mailbox that it didn't look like it was mailed. It didn't have a stamp on it. And it just says a good friend.
Right.
And that I should read it, that it's very interesting. At the time, I was studying biology and biochemistry as my pre-med.
Oh, okay.
And so I filed the card away, thinking nothing of it. And then 2 months later, when I got diagnosed, I looked it up and ordered it and started reading it.
Wow.
It just made a lot of sense to me.
That's great.
And decided to follow that. However, I did got talked into a surgery, which I regretted ever since.
Yeah.
That's my own personal experience.
Right.
And then worked with Dr. Clark down in Chula Vista.
Yeah, in Tijuana.
Yes.
Mm-hmm.
For 2 weeks, where I basically brought my cancer under control.
Right. And I think you told me earlier it went from some high amount, the blood test, to 4.
Correct. From 135 with the first blood test when I got there, which was much higher than prior to my surgery, by the way. So
how high was it at the surgery?
The surgery, before the surgery, I was like high 80s.
Okay.
And then post-surgery test was 135. So basically after the surgery, the cancer starts spreading, I guess.
Oh, okay. That's why you regretted the...
Right, correct. And then upon working with Dr. Clark,
Yeah.
I brought it down to 84, then to 47, and then to 4 in 2 weeks.
Oh.
So my cancer markers went rapidly down.
Very quick.
Yes, I was doing very stringent protocol with her at the time, learning how to avoid chemicals, how to clean my body of metals, how to prepare my food, what type of a food to eat. All of that was part of the stay there, part of the course that she offered at the time.
Right.
And so all of the combination with all of her 21-day protocol seemed to really work for me.
Yeah, that's great. That's great. And so what stood out when you were there? What did you feel like was the most important part of the protocol?
I think the understanding and the visual from the blood tests stood the most in my mind, because I could see progress. And any patient that is in that situation, that is told that they have only a couple of years in this earth, would understand what I'm saying. You want to prove that you are getting better, even if you don't feel better.
Right.
and doing the zapper work and the sound wave and everything else that was available at the time
Right.
seemed to really help me to get those markers down pretty quick.
Oh, that's great.
Yeah.
And what kind of cancer was it, did you say?
I had an ovarian,
Ovarian.
and I don't want to say anything else because by the time I went into the surgery, they couldn't find anything.
Okay.
So it was working.
So you did the surgery, by the time you did the surgery, they couldn't find,
No,
or
it was still in the ovaries. I still
Okay.
had the cancer in the ovaries, but my baby-producing organs were fine.
Oh, okay. Okay.
So, and that's what they thought. I had it all over, basically, through the whole reproduction system.
Okay.
And so it turned out that it was only the ovaries on the end, and they couldn't quite understand, looking at the x-rays and looking at the tests prior to, why would that happen. But I was already 3 weeks on Dr. Clark's
Oh, you mean you went back to the, so first you had the surgery, then you went to Dr. Hulda Clark,
But
and then you came back.
I'd done her protocol prior to the surgery already at home.
Oh, you had done her protocol.
Yes, I started her protocol for close to a month.
Oh, that's why
Yeah.
maybe there wasn't a reason for a surgery, but
Well, the ovarian cancer was still there.
oh, they saw that.
Right.
Yeah.
But everything else seems to come out clean, and they were puzzled by it. So I was already working. Apparently, my body was already responding well to the protocol.
Right.
And whatever wasn't really big and acute started shrinking and disappearing.
I understand now. Yeah. And so when you first learned about your diagnosis, how did you, of course, you must have been very afraid.
Absolutely petrified.
Yeah.
I believe I even passed out at the office,
Wow.
at the
Yeah.
doctor's office. It is probably the worst diagnosis that we all fear
Yeah.
when we become ill, and the doctor will tell you, ma'am, you have a cancer, or sir, you have a cancer.
Yes, for sure. I mean, I can only imagine.
Yes.
It must be horrible.
Yes, it
And
is.
so how did you overcome that fear?
Well, I went to Europe
Yeah.
for 2 weeks.
And to your family.
Went to my family, told them what was going on. I'm
Right.
originally from former Czechoslovakia, but from the Slovak part.
Right.
And basically, I don't know whether I was saying my goodbyes at the time, but I told them what the story was.
Mm-hmm.
And then came back and had the surgery. But while I was gone, I was still doing Dr. Clark's protocol. I had
While
it
you
all-
were traveling.
Yeah, I had it all in
Okay.
my suitcase, doing the
Right.
daily
Right.
and trying to do as best I could.
That must have been a parasite cleanse.
Yes, it
Right.
was a parasite cleanse, but it was also a few things to boost my immunity
Right.
that came with it that I figured out of the book what I needed.
Yeah, and so
And
so y-
glutathiones and
Right.
all the other stuff. Yeah.
and you being a biologist, I understand you have a great affinity for Dr. Hulda Clark's
Yes,
books and
for
her work.
sure.
Hmm.
I think that she was way ahead of her time.
Yeah.
We are now just catching up with a lot of the naturopaths and nutritionalists and
Right.
and other specialties,
Yeah.
and even the allopathic medicine to what she has been talking about 40 years ago.
Absolutely.
Yeah. So
I agree.
I just say she was a godsend, and I'm very happy I had a chance to meet her and work with her.
You did something good to
Yes.
get all this done.
Yes.
Thank you.
So, and I've been passing it on to anybody who wants to hear it and know it,
Yeah.
and letting people know how I did it, and giving them the choice to decide what they want to do. But please research. Make
Yes.
sure you find somebody that can personally fit the program that works for you.
Absolutely.
Yes. But so far, it worked for several of my family members as well.
Oh, okay.
And my niece,
Yeah.
who was in a 4th stage of abdominal cancer as well.
Okay.
Her ovaries and her uterus were
Wow.
both invaded.
Yeah.
And I think what helped a lot was the fact that she was also very diligent about the program,
Yeah.
and she was young. She was
Yes.
only 22 years old at the time. Her age made a lot of difference, I think,
Right.
in the whole story.
Yeah.
And a lot of the people that I come across, since I teach, I do come across people and wanted to know how I did it.
Right.
I'm more happy to tell them, and they've been following the same programs. And looks like, I don't want to say I helped, Dr. Clark helped a lot of them.
Right.
even
But you
higher potencies.
you
Yes,
carry the message.
I did carry the message. I felt it was important. I knew about it besides the choices that were obvious from the allopathic
Yes.
side of the medicine.
Awesome. Well, thank you so much. It was so nice to catch up with you again after all these years.
Thank you, Oskar. It was. I'm happy about the fact that I can still talk about it. I'm
Yeah.
almost 29 years later. I'm still here and I'm healthy. I ski. I play golf. I
All
play
right.
tennis. Do anything I want to.
Oh, that's so awesome.